This week's Ask Dr. Durie question comes from someone who's learned about another new Black Swan research project, one focused on studying families with myeloma. Well, we know that about 5 to 7% of patients with myeloma do have another family member who has developed or might in the future develop multiple myeloma. And the question has been, why is that? Why is there some tendency within families for patients to develop multiple myeloma? Well, the team under the leadership of Dr. Hartmut Goldschmidt in Heidelberg, Germany, plan to study the genetics. So take the genetic material from the family members and study what is unusual about the genetics of families with myeloma. And there are a number of possibilities here. There are options to look at genetics which influence the immune system. It may be that there is an immune defect. Patients who get myeloma have an immune defect so that myeloma can become active and grow without proper immune regulation. This is one possibility. Another possibility, for which we already do have some evidence, is that patients who get myeloma may be unable to properly process toxic chemicals. And so if a family predisposed to myeloma is exposed to toxic chemicals, their system is not able to break these chemicals down. They may in fact be able to activate the chemicals so they become toxic, but then not eliminate them from their system. And so these are some examples of the sorts of things that will be assessed as what we call genetic predisposing factors. And since there will probably be several of those, what is being done at the beginning of this project is to search for as many families as possible that would be available to study these various different factors. And so over the next 1, 2, 3 years, we will be able to learn what these genetic features are and understand much more about the underlying, and I suspect the diversity of myeloma. And once we understand that, it will allow us to come up with even better therapies targeting these different variants of myeloma. If the immune system is low, perhaps such patients will benefit from some of these newer immune approaches to therapy. And so the idea will be to identify the predisposing factors, certainly to alert the families and set up proper monitoring and screening, but then move on to come up with some refined approaches to treatment.